Dr. Pakman, is teeth grinding a big problem, and what does it do? Lots of people do it, some don't care. It does about teeth grinding, and if it is a problem, can it be prevented?
Yes. Well, teeth grinding, clenching, grinding, which we call bruxism, fit under the general category of parafunctional habits, and a huge percentage of the population goes through that. I would venture to guess that almost 90% of the population experiences it one time or another. Some people have it very chronically. You can imagine the forces that are expended by our jaws coming together in a very tight manner, and just in the act of clenching, hundreds and hundreds of foot-pounds per inch of pressure are developed. And then when you add to that a grinding from side to side, you can see that this has a tremendous toll on what we call the periodontium, which are the ligaments that hold the teeth in their mouth. So not only can we create a periodontal situation, we can also break and damage teeth, and we find this a tremendous problem in dentistry. So we've set about looking for solutions to this, and the simplest solution that we found are the construction of a night guard. They can be either soft or hard acrylic, and they're generally made by the dentist, of course, with a dental laboratory. And this seems to help break the pattern of bruxism, the clenching and the grinding.
I see. So when you wear those trays all day long or only at night?
No, just at nighttime. Now, I've had some patients that actually grind their teeth during the day, and they present a very, very interesting challenge. You have to do a little counseling with them to hopefully make them aware of the fact that they're doing it, and then when they feel themselves doing it, stop doing it. So,
I see. So those trays, are those trays probably slightly different, but more or less in principle similar than the one who you use for sleep apnea, where you prevent people from not getting air during the night, or the ones you give to kids in order to protect their teeth when playing football or some such thing, like skateboarding maybe or whatever?
Right. When we make athletic guards, they're strictly done in a very soft, rubbery acrylic material designed to absorb the shock of a blow to the jaw or to the face. When we're making one for tooth grinding or bruxism or clenching, we make them in a flat acrylic, a harder acrylic base, so that the lower jaw, we usually make them for the top, so that the lower jaw, the teeth can slide freely back and forth across the plastic surface, which dissipates the forces delivered to the teeth and the roots.
Okay. All right. So, wonderful. So is it very complicated to make those trays? I mean, not from your part. We don't really care about it. But for the patient, does the patient have to go through a long, arduous procedure, or is it a relative simple
No, it's very, very simple. We take impressions of the upper and lower jaw and an index of what the bite is, send that to the laboratory, and within a week or so, they construct the appliance. Wearing the appliance is very simple. There's only one way that it fits into the patient's mouth, and most people actually comply in the wearing of the night guard because it does help them.
Wonderful.
And I guess we should also mention, too, when we talk about night guards and bruxing and things, this is the leading cause of temporomandibular joint, or TMJ, dysfunction.
Which basically means brings your jaw out of alignments, gives you headaches, gives you neck pain.
Neck aches, shoulder aches.
Sleepless nights. Clicking sounds when you speak, whatever, right?
And it can also lead to degenerative changes in the temporomandibular joint, which may require surgery. So it's very serious. It's a very serious problem.
So basically, it's like if a hip is too much out of alignment, or a knee, it keeps wearing. Eventually, you need surgery and a complete replacement. And
exactly.
And that just, yes, you guys and surgeons do a good job, but why do we have to do that?
Who needs surgery? Right.
All right. Thanks a lot.
You're welcome.